Chaos is consuming the CDC after the ousting of the agency's director over vaccine policy and the exodus of other officials who resigned in protest. Those officials speaking out yesterday, promising to continue the fight from the outside.
What makes CDC great are the people that make CDC up, the scientists, everyone that makes this a family, and it's a family that defends our country and the health of our children and the health of adults. You are the people that protect America, and America needs to see that you are the people that protect America, and we are going to be your loudest advocates.
So let's bring in NBC Medical contributor, Dr. Vin Gupta. Dr. Gupta, thank you so much for joining us. Give us a sense for viewers who are waking up to this story this morning of why they should care about what's happening at a government agency like the CDC.
Katy, good morning. It's a question that's top of mind for everybody is, why does this matter and how is this going to impact me? There's a few things. First of all, these acronyms, CDC, ACIP, FDA, often there is a distance that you're pointing out between some sort of advisory committee on immunizations and, what does it mean for what I can get at my pharmacy when I need it? But that's exactly what's happening right now is these little nits and these conversations that Kennedy is having when it comes to, say, delaying an advisory committee for vaccine experts to meet. He's delayed this, and now there's no CDC leadership really in effect. What's happening is by doing that, by neutering that mechanism, it's impacting the ability of any American family to get vaccinated against things that they would typically be able to make a decision on to get vaccinated at their local pharmacy down the street because they're pharmacists, Katy, and this is the piece about how this impacts people across the country. Pharmacists can no longer do their job. And pharmacists have administered 90% since the peak of the pandemic of COVID vaccines, since the peak of the pandemic, 90% of them. And so you can play this forward. This is not just the COVID vaccine. This is what happens down the road with other vaccines. So what they're doing might seem esoteric. It might seem filled with acronyms, but it's impacting what the pharmacists on the street can and cannot do.
Vin, Sam Stein, good to see you again. We're talking a bit about sort of operationally how you can get vaccines in this climate and the fact that, pharmacies like CVS now in at least 16 states may restrict COVID vaccines because of this. I want to broaden it out a little bit because a lot of people turn to these institutions and their leaders to just have a sort of general understanding and confidence in the medicine. And in September, Robert F. Kennedy Jr. is going to unveil a study that he's engineered about whether vaccines cause autism. And the expectation, frankly, because he's been very open about it, is that he's going to conclude against all scientific evidence that, yeah, vaccines cause autism. And it's not true. But talk a little bit about the impact that could have on just sort of the layperson and how they think about vaccines and how they might now suddenly have skepticism about taking vaccines and the compounding effects that skepticism may cause for our public health.
I think, Sam, the challenge here is gold standard science, a randomized controlled trial in the world of medicine, published in a leading medical journal, New England Journal of Medicine, for example, no longer matters because what matters is a megaphone and the ability to be really good at marketing, which he is amazing at. He is incredible. Take what Maha is a marketing effort. There's no substance behind it, as we've now seen over the last 6 months. But it's, rolls off the tongue, and it's become the acronym of choice defining this, his tenure in this administration. But that's what matters more than, to your point, years and years, decades of research showing that there's no correlation between administering a vaccine, a progressively increasing childhood vaccine regimen, and the incidence of autism, which is also increasing for unrelated reasons. It doesn't matter. What matters here is marketing, skills at marketing, and putting out a message, which he's really good at.
Yeah, Dr. Gupta, I think we could sort of outline all of the many ways in which RFK Jr. has the appearance, the behavior of, I believe this is a scientific term, a quack. But I want to get to the question of like, okay, so who are they trying to install atop the CDC? Because it's Jim O'Neill, and I'm just reading our friendly neighborhood research packet here, a close ally of investor Peter Thiel, Silicon Valley investor, entrepreneur, has worked on issues such as longevity. What is the sort of ideology that is being favored here, if you were to describe who Jim O'Neill is from that perspective?
I mean, Jim O'Neill has been a technocrat in the George W. Bush administration. Hasn't done anything super controversial prior to the pandemic, Pablo. But I would say, just to give your viewers a sense, this is an individual early on in the pandemic who endorsed very strongly ivermectin, hydroxychloroquine, really all the talking points of the president back in the day. He's put out direct endorsements of those, obviously just misinformed views. So this is somebody that in many ways traffics and will rubber stamp is the fear. All the policies that Dr. Monterez and the leadership that just resigned said no, thank you. And so that's the concern here, is that his public statements here are very much in line with Kennedy's thinking, and he will be a rubber stamp.